Okay, chapter 7, page 48 in the ring binder, and page 52 in the textbook. All right, now this chapter is on all of the basic care skills that we're going to have in taking care of a resident. I've listed these in the order they are in your book. We're going to hit the high points each. I've put a star by the ones that you would be getting skill checkoff for. So pericare, dressing, foot care, dental care, and oral care are all skills you could potentially draw as a skill. Everything else is important to know, obviously, for the real world, but you can be asked questions on the written test on the rest of it. All right, so we'll start with bathing. One of the things that may surprise you in the nursing home is that these residents are only going to get showers twice a week. They usually on a shower schedule, Monday, Friday, Tuesday, Saturday, some sort of pattern. Now, they feel as though that there's a physiologic reason they should do that, and that's because their skin is thin, it's dry, it's lost its oils, and I can overwash or overbathe an area in terms of having then skin breakdown. So they're really trying to avoid that. However, it does not mean they don't get washed, and that's where we really see the CNAs tend to kind of take the skill away. Well, they'll get a shower tomorrow, we won't worry about it. We will be doing a bed bath every time we're there in the morning. We should be doing that in a home care because there's areas that we need to be concerned with. We need to be concerned with the armpits. That is dark, moist area. I can get yeast infections. For women with their breast, if they're not wearing bras, most of them, they're going to have to lift up the breast and look for skin breakdown there. The perineal area, which is referring to the groin, they're in a brief, they've sat in stool, they've sat in urine, so I want to be very attention to detail there. So we will be doing a bed bath each time in an attempt to provide the care. We do probably focus on the perineal area the most, just because, particularly for women, if we don't keep that area clean and get that brief off quickly, they're going to be at risk for a urinary tract infection, which is really easy to get when that stool, that bacteria is tracking back up to the urethra. So we'll be doing a really efficient job. Now, the thing that's interesting is when you learn the skill in the lab, we are going to learn it with 6 washcloths, where you get, a washcloth to wash, to rinse, to dry. In the nursing home, everything's disposable. It's the wipes, they're cold, and you're just going to have to use the same concept of wiping front to back and making sure you don't use the dirty part of the rag, but they don't realistically have washcloths and supplies to do what I would consider to be a healthy form. In this chapter, each of the skills that we're listing here, there is steps in the chapter that you follow. I don't mind you reading that, but when we get ready to do the skills, there will be some variations to this. And all the skills will be done from here. So if you kind of see the pages going a little bit fast as we go through that, you'll see that there's 14 steps to perineal care. I'm not going to cover that. We're going to do it with the skills book in the video. And then bed bath, the same thing. There's 20 some steps for that. Now, anytime you're working with water, and we're dealing with these 3 things initially. When I get the water ready for the resident, I want to always check the water to see that the temperature is reasonable. I want the resident to check the water as well. What do you think they're going to probably say?
I've had some say it's too cold.
Yeah, but most of them tend to say it's too hot. Oh, that's too warm. That's going to hurt my skin because their fat stores are gone, their skin is thin, it's dry, and they have that sense. You can modify that temperature, but you don't want to make it so it is cold because they may not understand that it is as cold as it is. So we're always going to make sure we test the water and they test the water. In the home environment, if they're getting into an actual bathtub, it's good to have those bathtub thermometers that'll just sit in there and ensure that you don't have a temperature that's too high because again, you can create problems with that. When we're doing the shower, we will do showers also in clinical. We will take them to the shower in a shower chair. And when they get there in the shower chair is like a porta potty without the bowl underneath it to catch the urine and stool. And so they're sitting in the shower chair, they'll have a wand that we will use, a spray wand. So again, what you'll do is you'll get the temperature where you want to, and then just let them touch the spray nozzle from that and make sure it's comfortable. Think about taking a shower at home. The most comfortable part of the shower is standing in under the water. It keeps you the most warm, it feels good. So it really is hard when they're taking these showers, and I got this wand and I'm kind of spraying all over. they feel cold and they hate showers. I mean, these residents hate showers. So what I usually try to do if I have help is I let somebody have the washcloth and do the showering while I'm keeping that water on a part of their body and they're feeling that warmth during the entire process. It's a good time when we're doing the bath, shower, and even the pericare that we look for skin breakdown. We look for any evidence of yeast infection because they're prone to that as well, again, because the area is moist and dark and it has bacteria. So, sorry, I thought I'd put that back on vibrate after I talked with Becky. So we're going to do that. Once they're out of the shower or their bed bath, we're going to get them dressed. Now again, in clinical, what you will do is if their shower day, we'll take them to the shower, do their shower, and then get them dressed. If they're bed bath, we'll do their bed bath and just get them dressed there in the room. When we dress them, the main consideration is first, let them have a choice in it. Pull out a couple outfits and say, what would you like to wear? Think about the fact that they usually do feel cold, and that's probably what you're talking about too, is they feel cold. So they usually, even in the summer, want long sleeves and a sweater. And then when they have had a stroke or an affected side, there's a rule that says that you will undress the unaffected, dress the defective. So I always undress the unaffected arm, and when I'm ready to dress, I dress the defective arm. Now, one of the challenges is Clarence, because he has two arms that are impacted. He's got these contractures here. So we really have to get creative, because literally this is about as far as his arm goes away from his body, and I gotta get these shirts over it, and he wants to wear a golf shirt every single day. So you have to get creative. But on the state test, they could test you on dressing somebody with an affected right arm. So your partner will have a stroke on the right side, and you'll have to show how you would handle that arm in getting them dressed. And again, the fact that you would undress the left arm first, and when it's time to dress, you would dress the right arm. Make sure that the clothes are loose fitting. Again, the elastic isn't rubbing in areas. You don't want things to be tight or binding for lots of reasons, not just comfort. And of course, make sure the clothes are clean. Magnolia happens to send their laundry out, so the residents' clothing is going out of the building to get washed and returned. The family can choose to do their laundry, but most of them do not. And so again, making sure that the clothes get back and they've got clean clothes, and I don't end up storing a bunch of dirty clothes and then that all goes out and they don't have anything to wear. Foot care, you're going to learn the skill of foot care, a specific skill. This really just refers to checking the foot and washing the foot. It does not involve cutting toenails, filing toenails, cleaning underneath toenails like you would get with a pedicure. The feet are one of the areas that's prone to skin breakdown because our circulation in our body knows to keep the core of the blood in the most important part, which is basically from the top of my head to my groin. So if I begin to have circulatory problems, I tend to have it in the fingers and toes. And again, you'll see elderly people say, oh, my hands always feel so cold, or my feet feel cold, or they'll say they have pain. There's something called neuropathy that they can get where their feet hurt. So two things happen. One, the feet many times are cold. Secondly, they might not have the same sensation, so they may not know when they've got a cut or a nick or an ingrown toenail. So the foot care is important, so we pick up on that. Again, I mentioned to you Barry, he ended up losing a leg because of a bed sore to the heel. And if somebody had been doing foot care and monitoring, that probably would have never happened. The facility will have a podiatrist on staff. And the podiatrist will come in typically about once every 6 to 8 weeks, and they will do the toenails. They'll actually do the cutting. Their nails get really, really thick. And so they'll have literally a drill and a type of device that we wouldn't have, and we want to make sure that that gets done by them so that we don't put a risk on. We should not let these residents walk barefooted ever. And I know that's hard, particularly in a home setting. And we should never allow them to wear shoes without socks. Because again, the whole idea that the foot can end up having breakdown in it and we don't see it and it becomes a problem with circulation. Nail care used to be a skill that you were checked off in. They have taken that out. They've taken out nail care and making an occupied bed. They still can ask you some questions. So nail care is like a very mini manicure. You basically will take and soak their fingers in some soapy water, and then you can take an orange stick, you guys have seen the little orange wooden sticks, and you can clean underneath their nails, because again, they may have their hands in places they don't realize. And then you can feel the nails for ridges, and in that case you can file just a ridge because you don't want them cutting themselves or nicking their own skin because they've got a ridge on a nail. But that's really all you can do with nail. They do have something called glamour nails on Monday. It's usually from 10 to 11 on Mondays. It's at the activity room. The ladies love it. They all want to go to Glamour Nails, and they will actually paint their fingernails for them and kind of shape their nails. And the activity staff's been trained to do all that. So if we're there on one of the days they're doing it, we'll definitely try to get the residents down there. Shaving, the next skill, this is something that if you do it Magnolia, you will likely do it with an electric razor, just for safety reasons. The electric razors still are probably locked up in most instances, and when you shave, if you've seen electric razor for men, it's pretty much just a circular motion. If you should have to shave them with a safety razor, then you've got to know that it's very different than the way we shave. First of all, their bristles are very, very coarse. And so typically you take a washcloth, a warm washcloth, and put it up to their face to soften those bristles a little bit so it doesn't pull so much on the razor. The second thing that's really different is they shave with the growth of the hair, not against it. So when we're doing our legs and we're working up our legs, that's against the growth of the hair. On their face, we're going with the growth of the hair. Obviously with the razor, there's the chance of getting nicked, so we want to be careful to do that. One of the activities that I've seen people do, they actually just had it on The Amazing Race last Sunday, take a balloon and try to shave a balloon and try to create, and see if you can do it without popping it so that you get that sensation of what needs to be done. The test questions that have been asked on shaving in the past have been, they had a question similar to, you're getting ready to shave your resident with a safety razor. Which of the following steps should be first? And it has, that's the right answer, is to soften the bristle. But they'll have like apply after shave, shave with downward strokes, which are all good. But it says what's the first, and the first thing is to soften the bristles to make it easier. The next one, mouth care. Now they use three terms. They use mouth care, dental care, oral care. Those are three separate entities. So make sure when you're reading a question, you know what they're asking about. The question that's been on the test in the past for mouth care is, if you have a resident who is unresponsive and is a mouth breather, how often should you provide mouth care?
Every 2 hours.
And it's every 2 hours. But a lot of people think mouth care is like brushing their teeth or doing something different, so they'll say once a shift, or they'll say once a day, or they'll say after meals. And what we're looking for is the individual who literally has kind of this dry, parched. Maybe they're on oxygen, maybe they're mouth breathers, they're unresponsive, maybe they have a feeding tube. And what that refers to is taking those little orange pipette sponges. Do you guys?
Orange, pink, and green.
Yeah, the little pink, I'm sorry, the pink ones, the pink sponges. I'll get one for us to look at. But we just take the sponge and we moisten it, and then you can take that and go on the inside of the mouth and moisten the mucosa so that it's not so parched and dry, because that's going to affect the health of the gums in the mouth.
Also does it on medication too, like Roxanol and atropine.
Oh yes, they
Those
dry
are
the mouth.
two, yes.
Yes.
And oral care is very important during that time, because the morphine will actually burn the mouth if it's extremely dry already.
Yeah, and so you do want to make sure. So the answer for that is every 2 hours, and that, again, we're only referring to the moistening of the mouth. We're not referring to hygiene of brushing anything. When they use the word dental care, they're referring to brushing dentures. So if somebody has dentures, they typically will be in the bathroom. They should be in a denture cup. They should be submerged in water so they don't dry out. And you would be going in the mornings and cleaning the dentures, getting them prepared, putting the adhesive on, and putting them in their mouth. Now it's going to be interesting. You're going to see a lot of residents that you think, where are their dentures? Because they have virtually no teeth, and there aren't any dentures. Couple problems with dentures. One is Medicare doesn't pay for dentures. And so you've got to have a ton of money because they're not cheap. Secondly is, we talked a little bit earlier, are they going to maintain weight, gain weight, or lose weight? They're going to lose weight. And as much as you may not realize, your gums can also have some receding when you lose weight. So even if they have this beautiful set of dentures that was fitting when they were admitted, 6 months from now, they may be flopping around in there, even with adhesive, and they get frustrated. They say, you know what, just forget it. It's easier for me to eat without them.
Or they could have done what a resident done to my, hers. She dropped hers and broke
Or drop them, yes, yeah, and we have to be really careful because we don't want to do that either.
No.
We always are going to do them over the sink. The other thing we saw happen is we had a lady who had a partial, and she took it out to eat, and she put it in her house coat pocket, forgot, none of the CNAs were paying attention, it went to the laundry, got washed. When you're doing the entire facility, how are you ever going to know for sure whose that is? You know, if a family may be able to identify, but for the most part, you're in trouble, and she did not get it back. Matthew's grandmother was living in a facility in Charleston, over 100 years old, and she had a really nice set of dentures, and they got lost. Who lost them, I don't know, but they got lost. And, you know, my father-in-law was in a position to get her dentures. And she said, no, don't bother. I don't want them. And then she started losing weight. And we thought, oh, she's losing weight because she's not eating. And she point blank said, you know, when you don't have teeth, you don't like to eat. When you don't like to eat, you're going to lose weight. I mean, you almost wonder if it was intentional at that point that she had lived so many years. She was done. She was done with that whole process.
There's some even refuse because it doesn't feel right. I
Yeah.
had a resident who just absolutely, she had them,
Yeah.
but she just didn't want them.
Yeah. And I have a student in my current day class that's testing next week, and she has them, and clearly whoever got her dentures for her didn't fit them well, and they stay in place, but it creates an incredible lisp, and she says it. She said, I hate these dentures, but I can't afford to get another pair, and she has just a real hard time speaking with them in place. Brushing teeth then is referred to as oral care, and that's actually with the toothbrush and toothpaste. We're going to brush each other's teeth today, and that's real. We'll actually go through the steps of what needs to be done. It's no different than brushing your own. The automatic failure on that is not brushing the tongue. The mouth is the dirtiest part of our body, even more so than the rectal area. A human bite is the worst kind of bite you can get of anything, worse than a dog bite, a cat bite, anything, because of the bacteria that's in our mouth. So we do want to make sure and brush the tongue. We do not floss, typically. If you do have somebody who wants to be flossed, it's okay, but really make sure and watch the gums, because if they're not doing it regularly, the gums are going to get really puffy, and then when they do it, they're going to bleed. And then are we doing them any favors to do that? So you won't see us doing that in clinical at all. Hair care.
Mouthwash.
A mouthwash is okay, or a rinse, yes. And actually there's a biotin rinse that is not just to rinse the mouth, but it helps provide moisture for those residents who are on medications that dry out their mouth. And they can swish that around and spit like they would a mouthwash. Hair care, the hair care is usually done on shower days, meaning that when they go to the shower, we go ahead and wash their hair. There is a beauty shop at the place. And it's a nice little beauty shop. I think it's got 2 or 3 chairs, and you go by and you seem like it's never open or open very infrequently. The reason? It's not a covered expense. So the only way you're going to get to go to the true beauty shop at these facilities is if your family pays extra for it. And so again, it's sad that, you know, we've got that ability and we don't do that. When you guys are doing their hair, wash their hair and then try to do something with it. You know, brush it, fluff it. It's the same thing with all of us. I mean, they don't want to go back to their room with a wet head and lay down and have, you know, a matted place in their head. They really do like their hair done. And just even brushing it between days, it feels good to have their hair brushed, and they like to have it brushed. So offer that every time you're doing your bed bath and getting them dressed and getting them up. Offer, would you like for me to brush your hair this morning? I will tell you 9 times out of 10 they're going to say yes.
We always got in trouble if we didn't brush their hair. If they went out in meals and didn't have their hair brushed, it was a big no-no.
Well, it should be. I mean, it really should be, I think. I mean,
Yeah.
it's no different than us leaving the house. I mean, we don't
Right.
want to leave the house unless we're fully dressed, we've brushed our teeth, we've had our hair brushed, and so it's no different. It's trying to give them some level of dignity. All right, so these are our basic skills. Again, the ones you can be skill tested on is pericare, dressing, foot care, dental, and oral. These are the 2 we're going to do today to get checked off on, oral care and dental care. Make sure you've got those 2 skills. The rest of the ones that don't have an asterisk by them, they can ask you questions on the written test, but they will not do a skill for it. All right, the next part of the chapter, page 50, starting on 59, really overlaps to chapter 4 when we talk about skin care. We talked on Friday about the aging skin, you know, the wrinkles, the dryness, the loss of oils. And so we want to take care of skin even if there's not skin breakdown. How can I do that? Well, I can use lotions. As long as they don't have skin sensitivity, there's no reason that I can't provide lotions or moisturizers on their skin. I'm going to constantly check for any breakdowns, bruising, abrasions, shearing, anything on the skin. I can do massages, and we're not talking about massages like you go to massage and to get an hour massage. We're talking about just a comfort massage. And so it helps the circulation of the blood to that part of the skin. So having them lay down and massaging an area. The only area that we suggest you not massage are the legs. And the reason being is residents can have blood clots. And if I massage the legs, I can take those clots and they start moving. They're in the venous system, the veins. The veins are returning to the heart, and they can end up actually dying as a result of a thrown clot. So we do not do that. In your ring binder in chapter 4, I gave you a diagram of areas to look for pressure points. So again, it's a better diagram than the one in the book on page 60, but just know that those are the areas that we want you to look for on the one that I gave you. I actually gave you a lateral, a supine, and a prone handout for what to look for in chapter 4. So just use that as a better example for this. I already told you about what happened with Barry, about the heel and not checking it. So again, it's important that we check the areas and we make sure that we don't see that. If the sheets are wrinkled or bundled, that actually puts them more at a risk. So we want to make sure the sheets are smooth and free of any wrinkles. And we want to make sure that nothing's gotten down in the bed. If they eat in the bed and they get crumbs in the bed, then we need to be cleaning that up and not having any debris in the bed. Residents do need more rest typically than we would expect. Most facilities require that the residents be in bed by about 8 o'clock, and most facilities require they get up at 6. So they get about 10 hours of sleep or 10 hours of bedtime. But again, imagine if that's not your routine. I mean, if I had to go to bed at 8 o'clock, I would be laying there for a couple hours before I fell asleep. And if you made me get up at 6 in the morning, I do not like morning. I'm not a morning girl. They don't have a choice in this. So again, trying to provide some level of comfort or reassurance so that when they are sleeping in the bed, that they can feel rested when they get up. If they're having trouble going to sleep, goes back to the coding, they'll go ahead and code a diagnosis as insomnia. And then with the diagnosis, you have to give a medication and treat it, so then they'll order Ambien. And now we've again got a higher payer code because we've got a diagnosis and we're giving a medication we can reimburse for. So you can take a vicious cycle with that as well. Bottom of 63, again, I'm not exactly sure why it's here, but it just reviews those devices that we talked about earlier. The bedpan and the two types, the one we're going to use for putting somebody on the bedpan, the urinal, which is for the gentleman, the fracture pan or orthopedic pan to use when you don't want much movement. And again, we'll go through the bedpan skills separately from the steps on this. The last part of this chapter is, again, it's overlapped in another chapter, but it's talking about bowel and bladder problems. In the bowel issue, more normal bowel movements, more constipation, more diarrhea. What do you think?
Constipation.
Constipation, absolutely. They're constipated because their diet may not be as high in fiber and their dietary needs. They may be constipated because they're not taking in enough fluid, enough water, and we have to have water. They may have in their colon, their intestinal tract just isn't as good as pushing things through, and so you can actually get obstructed.
That muscle, whatever that muscle's called.
The sphincter.
The sphincter
Yep.
muscle.
So those are reasons that they get constipated. If they have not had a bowel movement for 3 days, it is a reportable event so that they can make sure and do something about it. It might be Miralax, it might be a suppository, it might be an enema, but we can go very quickly from constipation to a bowel obstruction, and once they're obstructed, they end up potentially needing surgery, and that's not a good thing for an elderly resident. The thing with constipation, I think probably I would say the two highest reasons in the long-term care facility that I'm familiar with at Magnolia is lack of fluid and lack of mobility. Because the other thing that helps with your bowel movements is being up and about. If you lay in the bed for days and days and days, you can get constipated. Also, if they are given any type of medication with an iron supplement in it for whatever reason, that can make it difficult for them to go to bed.
Too.
Yes, narcotics also make them constipated, absolutely. We had a situation in clinical. We had a resident, Miss Sullivan, and she was eating her lunch, and she had finished all her fluid. And so one of my students said, would you like for me to just get you some more water while you finish your lunch? And she said, well, yeah, that'd be great. So he went to get water, and as he's coming back, there's a CNA from across the room says, hey, water boy. And he looked up, and she said, I don't think so. You're not the one here this afternoon to deal with that. And I thought, oh my gosh. So not only then are they creating potential for constipation, but now we're going to have urinary issues as well, because they're supposed to urinate once a shift. And so if they're not getting adequate fluids, they're not filtering their kidneys, they're not eliminating waste out of their system, they can get in trouble as well. It's interesting if you think about training a child for bowel and bladder training, we do that through repetitive action. So we do that by taking our child who's about 2 years old and saying, okay, we're going to learn to go potty, and you get up in the morning and you go straight to the potty and you let them sit on the potty. And then they play a little bit, and then it's almost time for lunch. Let's try to potty before lunch, and then let's potty after lunch, and let's potty after naps. Let's potty before we go to bed. You put them on a schedule, and that's what creates the bowel and bladder training. We can do the same with adults. The problem is as we are adults, our body kind of reverts to what happened when we were children, and it's hard for us to hold urine, particularly females. And so what ends up happening is we need a more rigid schedule for going to the bathroom. We've talked about this in, I think, both days. The problem being is if I'm supposed to offer you toileting every 2 to 3 hours, which is what I should do if I want you to be able to hold it, that's about reasonable, then that means if I have 10 or 12 residents, I literally could be doing a cycle of toileting for my whole 2 to 3 hours and never get anything else done. So again, they typically will put the brief on them, and again, tell the families, well, this is just in case they have an accident or we can't get them to the bathroom. And the reality is, they're not taking them to the bathroom. They're just allowing them to soil their stuff. We have actually heard staff say, go ahead, and we had a resident sitting at breakfast or lunch and said she needed to go to the bathroom. And the CNA that worked there said, well, we need to finish eating first. And she said, I don't think I can hold it. I need to go to the bathroom. And she said, well, just go ahead and go in your brief and I'll change you after lunch. I mean, it was just outwardly stated. I know, it's incredible to me. And again, this is not exclusive to where we go. It's a problem across the board. We have residents in our home care setting. We have a gentleman who's paralyzed from the waist down, and he does not want to stool on himself. So he went into a bowel and bladder training program. Luckily, he's a VA patient, so they actually pay for it. And what we do when we get there in the morning, we leave him in bed and we do a suppository. And he lays there in the bed for about 20 minutes, and his bowel will evacuate. And sometimes we have to take a finger and help get some of the stool out. He will not soil himself the rest of the day because they've trained his bowel to do that. We've got another client that during the day, he's willing to tell us he needs to go to the bathroom, but at night, he says, when I'm down for the night, I don't want to get up. So he chooses to have a condom catheter on, and then if he wakes up and needs to go, he just pees and it's in the bag and he doesn't have to get out of bed. So there's all types of ways to retrain or to do that, but again, you're not going to see that mainly because of the manpower issues. Page 66 and 67, when we do chapter 12, I'm actually going to go through each body system. I'll take them like the 10 major body systems. We'll talk about which organs are in each of those systems, and then we'll talk about the top 3 diseases or conditions that occur with that. And so rather than do that in this section, we'll do that in there. So any questions about these procedures, these skills? Again, it's hard for me when we do this class because I have to remind myself this is 8th grade reading level, entry level, CNA. I mean, to go into more physiology would be fascinating, but just remember, if this is seeming really easy, it really is that easy. It's basic.
On the foot care, do you also do, I forgot what they're called, they're heel protectors, but they're just like
a lambskin or lamb's wool?
Yes.
If the resident is prone to skin breakdown on their heels, they typically will be in some sort of heel protector. A lot of it's made out of lamb's wool, and it doesn't create the same friction or rubbing in the bed, but you still have to remove those, inspect that area, and still do the normal foot care. The only thing that's kind of the no-no on foot care, other than actually cutting the toenails, is leaving lotion or moisture between the toes. Same idea, armpits, groin. You can end up skin breakdown as a result of that.
But, I mean, do you have to get, do you have to get a resident and make sure that that is applied to the foot or,
No.
foot or feet?
No, if it is ordered by the doctor, and it would be a medical order, it would be, you know, heel guards, whatever, at bedtime or whatever, then the nurse can direct you to put them on, but it is not your responsibility unless you've been given that order, because that is a medical order that's in the medical record, and you all don't transcribe orders from physicians. It's like, you know, medication orders, physical therapy orders, that's all the staff.
The reason why I was asking is because I had a resident that she did lose her foot, her actual below the knee amputation.
Uh-huh.
Yeah, and